back with another episode of the You're Done podcast. Woo! I love when people like who've been listening and they come on, they know like we fit to act the fool just for the intro. Yeah. But it's your girl, Be More, nevertheless, and I've said it once, I'm gonna say it again. Desto will be back. She's just on maternity leave, okay? This is our last episode of the Mom series, and I think it's like the perfect way to kind of end the series around this particular topic. So we have Miss Olivia here as our guest. Woo, 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 woo. You know what? I need to know how to make the sounds work on my thing. So then I can, like the little horn. Because I be out here really doing my best with my own. But I'm going to introduce my girl first, and then I'm going to let y'all know what we talking about, okay? Oh, and also, for y'all who may just be tuning in to the Mom series, this is literally us having real conversations around motherhood. Not your Instagram highlight, not your perfect blacked out curtains with the sound, the music noises, your baby sleeping perfectly. No, we talking about the hood, motherhood. Emphasis on the hood part, because it be real.
Yeah.
Real. So anyways, getting into it, and I always want to say Osborne. So I'm glad that that's her maiden name. Not to put all her information out there now, but Miss Olivia Owens is a registered nurse specializing in maternal newborn care and a certified, lactation consultant, as well as the founder of Kind Body Empowerlac, a practice dedicated to providing compassionate, evidence-based lactation support to families in the community. As a mother of three, motherhood, okay? Each with their own unique breastfeeding journey, her personal experiences deeply inform the way she supports families today. She created Kind Body Empowerlac after struggling to find the support she needed with her middle child and recognizing a gap in accessible, skilled lactation care for mothers in her community. With a background in nursing and sociology, she brings both clinical expertise and a broader understanding of the social, cultural, and structural factors that influence infant feeding. Her work centers on helping families feel supported, informed, and empowered through every stage of their feeding journey, including breastfeeding support, pump education, and helping families navigate resources like obtaining breast pumps through insurance. If you thought that was long, it all needed to be said. When I read it, I was like, nah, I ain't taking nothing out, because I feel like that's exactly what a lot of people need to hear, especially people of color. Because I know y'all be thinking, oh, breastfeeding. No. It's for everybody.
Yes.
Okay, not just one size fits all, and access can be given to all. Welcome, Miss Olivia. How you doing?
I'm good. I'm tired.
I know, right? And that does lead to the very first thing. I've been starting every series off, because I don't feel like when you're a mom that people ask like, how is the mom doing? It's kind of like, well, how the kids? Like, what did you do? And then exactly, you came in and then you was just like, well, my kids act like this. Yep. So it's just like, how are you doing? Right? How are you doing today?
I'm actually doing good.
Okay.
I feel like starting the business kind of gave me my own sense of me.
Yeah.
So, like, being here to be able to do this for me, I'm feeling good today.
Yeah.
And so, like, I was, like, looking forward to it. I'm like, yes, I get to do something for me.
Yeah.
So I'm excited, and I'm feeling good.
That's
and then
good.
I go home and be back for them.
But this
I got this time.
Right. For
about
these
me.
next 35 minutes, it's all about you. Now, I mean, we gonna mention the kids at some point.
Yeah.
But for the most part, we just explaining all the great things that we do.
Yes.
You know? So that's good. I'm glad. So Olivia, I follow Olivia on social media, and I've been knowing Olivia since, I don't know, middle school?
Yeah.
For forever, literally. And so when she put out that she had this business, I was like, would you mind coming on? One, I've also have 3 kids, 3 totally different experiences. Like, when I say different, like, not one mimics the other in no form or fashion.
At all.
But with this last one, and I do mean my leg, I know I'm part of the No 2 Club. He was my hardest because, one, he's my only, well, we're trying to transition into the bottle, but he's my only exclusively breastfed baby. Mm-hmm. So when I say I walk down to the bus stop with homeboy on the I'm covered up. I don't like to pull my boob out in public, but this has been like
something new.
What? Yeah. And very ghetto, I must say. So my first question is, what are some of the biggest misconceptions new moms have about breastfeeding before they even start breastfeeding?
So a lot of moms like to think, or everybody thinks, breastfeeding is natural. Because yes, the milk comes from us. It's free. It's natural. But it is not something that you just know how to do. It is a learning process. A lot of people, like if you take the prenatal classes, and that's one thing, a lot of prenatal appointments don't go over lactation. When I had my last two, when I went for my initial prenatal, they gave me a book and said, how do you plan to feed your baby? And I was like, oh, I'm a breastfeed. And they're like, oh, okay, here's a sample of formula. I said, what? But okay. But that already gives you in your mind, like, oh, they expect me to fail. But then it kind of makes that mom that doesn't know about breastfeeding like, well, is it not good? Am I not supposed to? So it's a lot of different things that you get from social media, from your doctors, from outside people that you're just like, well, should I not breastfeed? Yeah. And then when you get in the hospital and you're like, oh yeah, I'm gonna be able to put the baby on the boob, and you're like, why is the head what is happening? Why can I not latch my baby? What? And I'm sorry, y'all, when I talk about breastfeeding, I do tend to grab and touch. So
listen,
just a forewarning.
I done hacked these things up I don't know how many times on here, so it's all good.
But a lot of moms, like, they're like, oh, yeah, I'm going to do it. And then they get in the hospital and they're like, this is not what I expected. Yeah. And depending on where you go, a lot of you may not get the help you need in the hospital from the people around you. Or if you have family that didn't do it, they can't help you. So you're like, you know what? I'm not going to do it. Just give me the bottle. It's a whole lot easier. So I do try to encourage moms, try to get that prenatal education, try to talk to somebody. I don't always say go to TikTok, but if that's the only place that you can go to get some kind of prenatal to know what to expect, at least try to get some information before you get to the hospital.
Yeah. I like that you said that they just expect you to know how. And I think the most frustrating thing, and I didn't learn this until I got Breland, which was even more interesting because I didn't even breastfeed Breland long because I ended up having an abscess, which then I was on all types of drugs, and it was a whole nother situation. So, but after her, and when we thought hey, we're going to try again, that lactation consultant was like, hey, I know you're getting frustrated, but your baby is also learning how to latch. And I think a lot of people don't say that enough, that not only is it the mama's first time, but we just assume that, oh, the baby knows how to do it as well. And so you getting really frustrated with yourself when both of y'all are learning at the same time. And Brielle was a football help baby. My other babies were cradle. So I started with the football hold because I was like, well, when I tell you, I put Deuce in that football position and felt I was about to throw him for 100 yards. The back MVP was about to be me because when he latched onto that nipple and tried to take it off. Oh my God. In that moment, I was like, yeah, I'm not going to be able to do this. And I wanted to quit right then and there. But then I just was like, then I did like that they gave me the formula. But the lady that came in, she did say, this is only if you need to take a break. Because, of course, he needs to eat. So don't feel pressured. But when she told me that, I was like, okay, so we're both learning. I don't know. It just made me kind of feel like, well, let me not put so much pressure on myself because I'm teaching my baby as well. And I'm learning with him, even though, again, this was my third time doing this. So I'm glad that you mentioned that because I don't think a lot of people remind the mom that the baby also has no freaking idea what they're doing.
They're both learning together. Yeah. Each and every time.
Every time. You hear that?
Especially those first couple of days, because baby is like, what am I doing? Why am I out here? What happened to the secure place that I was in? So the baby is making all kind of adjustments, not just trying to figure out how to feed. With you, being patient is an understanding that he or she has to learn too.
Yeah, this has nothing to do with any of my questions, but I do have a quick question. So. With Brielle, I don't feel like, in saying that she was my first, maybe she was just a really great latch baby. Once we figured out her position. I don't remember my nipples ever bleeding. having to like quote unquote get hard. A lot of people are like, oh, well, it's gonna hurt because they have to get hard. And I'm like, what does that even mean? I would do. When I tell you that I took the pump off and blood was floating in my pump, devastation. Okay, about as red as this shirt I got on. Yeah. And I just started crying because I'm like, what? And then they hurt so bad. Yeah. But it was, a lot of people are just like, oh, like that's okay. And I'm like, but then at the same time, they're like, you're not supposed to be in pain. So are my nipples supposed to quote unquote get hard? Like, am I supposed to go through the trenches first and then?
No. Okay. So I'm not gonna lie. When I had my first, who's now 11, and I went through the breastfeeding, wasn't a nurse, didn't know anything about breastfeeding, and like you said, I had no issues. Like we breastfed. I only stopped because I think I became a teacher and like I couldn't pump because kids was in and out my room all day. But I had no issues. Yeah. And then when I learned what I was supposed to do, I'm like, did I do that? Did we go through that? But so when they say your nipple's supposed to get hard, those first couple of months or those first couple of days, like you said, baby is learning. So that latch is not all the way there because baby has to learn how to latch, suck, swallow, breathe. And so your nipples in those first couple of days, they will get tender. They may start to bleed if that latch is not effective. But also, that's why you should see somebody in those first couple of days because you have to fix that latch. Now, of course, if the latch continues and your baby just kind of, so your body, everything we do, we adapt. Yeah. So your breast will start adapting, baby will start adapting. Well, this is my latch. This is how I get the milk. Your breast will start adapting and they will start, you'll bleed, you'll scab up and they'll get hard, but that's not normal. Okay. So it shouldn't be that way, but since none of us get the help in the first periods when we need it and we're like, oh, okay, this will go away, this is normal, but it's not. Yeah. So yes, your breast adapt, but once you get that good latch or that effective latch, then it shouldn't happen again. Okay. But even with my last one, I'm like, why do I have pink milk? Like I knew I had pink milk, but I'm like, really, girl, what are we doing? Yeah. Like, no ma'am, come on, we gotta fix this. Right? But it happens. Okay. But it's not normal. Okay. No.
I learned that, well, it's not supposed, I didn't know it wasn't supposed to happen because I was like, they kept just saying it's going to get hard. And I'm like, this is stupid. Yeah. So then you kind of just push through the pain. But I did end up seeing a lactation consultant. And one thing she did tell me is she was like, well, what shape is your nipple? And I was looking at her like, now I know you know what the nipple look like. I know what the nipple look. But I was like, well, I only know what my nipples look like. Maybe other women's nipples look like triangles. I don't know, okay? Yeah. But one thing she was saying that I did experience is that when Deuce would get done eating, the bottom of my nipple would be flat. And she was like, well, you don't really want that because how it's sitting in his mouth isn't right. And so he is putting a lot of pressure. And also, one thing he would do is I kept saying he comes off and he goes on. He comes off and he goes on. And she was like, well, he's trying to stretch it because the way it's already in his mouth isn't right. So he's not really getting a flow. Yeah. All it is, no one. Yeah. And so like your baby, even though they're learning, they figure out, I gotta put it in my mouth this way to get it to do this. So of course, now I'm coming back on. Like, so you'll notice your baby is also trying to self-correct. Yeah. So that's why I like to tell a lot of moms, like, don't try to constrict your baby as much. So a lot of people like to do the cross cradle, but they hold baby's head. Yeah. I always say, put this arm around baby and this arm on your breast. That way baby can move the head as they feel because they're also trying to get comfortable on your breast. Like, but we always have a tendency of grabbing their head and putting them on the breast. And it's like, would you want somebody grabbing your head and putting your head in pizza? Like, have a way that you want to eat your food. And so do babies. So once they learn, they're like, no, I have to suck it this way. But that is one thing I like to tell moms is when the baby comes off, how does your breast look? We don't want it flat. We don't want it angled at one side or angled to another side because then it also tells you how the baby's tongue is around the breast, how the breast is in the mouth. And if baby doesn't have a good latch, they're not getting the milk.
And then a lot of moms are like, my baby comes off frustrated, or my baby is getting frustrated in the middle of the feed.
Yeah.
It's because he's not getting anything. It's the flow. Nothing is coming out.
Yeah.
So just like when you drink out of a straw, you expect something to come. If you have a kink in your straw, you're going to get irritated too. And you're like, I don't want this no more.
Don't let me go to Whataburger and they, you hit the straw and they get a break.
A little crack. Yeah. That's the same thing with babies. So now moms are like, well, I guess I don't have anything. Now I'm giving formula. Now you done disrupted your whole supply because now you gave formula, you missed the feed, and now we trying to catch up.
Yeah.
So that's a lot of things that moms are like, well, I don't know. And I'm like, yeah, baby is telling you that something's not right. Like, baby's trying to tell you in that feed something's not right. So I always say, try to catch it before they start yelling at you.
Yeah.
Because once they start yelling at you, you done lost your chance. Like, nope.
Yeah, no,
give me something that's easy.
Yeah. That's a good point. Yeah. I did stop holding his head.
Yeah.
And I wasn't necessarily like, well, I did feel like, well, my boob is right here, so I'm going to put your head right here. And so I did stop, and then I started doing it, and then it's a lot easier. I have not become that parent where people be like, oh, I just sleep and leave my boob out, and the baby just, girl, the blessings that you have, I wish I could just lay there and he would just eat. We're not that lucky. I'm not that lucky. Oh, listen, are you that lucky?
Yeah, 2 and 3, I was like,
oh my gosh, it's such a blessing. Because let me be real, my girls know what a boob look like now. Because I'm not about to tell you to leave the room. I'm not, like, I gotta feed the baby. It is what it is. Now, Deuce is nosy. So if he hears noises, he's that baby that's like, dude, over here, let's finish.
And it's only gonna get worse as you get older.
No, we're trying to move on to the bottle. Okay. Now, he's not a pacifier baby. By no means. And I know some people are like, oh, my baby likes to no, he hates the like, spits it out and looks at you like that eyebrow raises like, haha, like, yeah, I'm not taking that. So I don't know if that has translated to the bottle, but homeboy will not take a bottle. But let me put a boob in his mouth. He good. So we're trying to get to that point because once he start pulling on my clothes, you got to go. Because I wish you would try to undress me in public. Embarrassing me.
And he will. They will.
And I gotta try and get him out. So I'm not necessarily, I don't want to go cold turkey with him. Mm-hmm. So I'm slowly, he gets a bottle maybe once a day. And then he's eating food because he's greedy. Yeah. So he had applesauce for the first time yesterday and he ate the whole thing. Boys, I don't know how I'm gonna feed this kid when he starts eating table food. Yeah, he's a boy. He's gonna eat me out of a house and a home. I was like, okay, so he took the one bottle and that was good, but he's still very much so a breastfed baby. But we're like slowly, like literally one bottle. And then,
did you have somebody else give him that bottle?
No, because I'm at home by myself. Okay, so now I gotta get.
So wait till like in the evening.
Yeah.
When Brienne's is home, and then I would say, all right, your turn. I'm going in the shower. Because if you're in there. Or you're there, he gonna be like, I want mine. What you doing?
Yeah.
Like, why are you giving me this and you right here? I would say, Eric, if you're starting, especially in those first couple of days, I would say give it to your husband, let him do it, and you leave the room. Like, I'm going to take a bath, I'm going to do this, let him try to feed. It'll probably go a lot smoother, and it'll kind of help. That way, when you are home alone and you're trying to give it to him, he'll be like, oh, okay, I know what this is. I'm still getting my food. You're getting it. Of course, if you see something you want versus this, but you right here.
Yeah, exactly.
And then, of course, when you feed him the bottle, he right there next to the boob as you're feeding him the bottle. So he
be like this. Yeah. Y'all done seen me tease my baby multiple times because when I say, he be like,
yeah.
I'll be like, I shouldn't sit here and laugh at you. But this stuff is hilarious.
It is.
Because you're very extra. Mm-hmm. I'd be like, at this point, I should be drinking it if it's that good.
He got you acting like that.
Right? Because, golly. Okay, I'm going to get back to my question. We went on a tangent, but I really wanted to know about that. So my next question is how can moms tell the difference between normal breastfeeding struggles and a sign that they may need extra support?
So, again, like we said, everybody is learning. So if you feel as though, some things is just learning a position or trying to make sure baby is latched right, baby is getting enough, there are certain things you can look at to make sure that baby is getting enough food. Yeah. So like his or her diapers, weights, even feeding cues. So if baby is like coming off and still trying to like suck hands, move heads, then you may need to go ahead and back and latch. Now, if you're noticing that your breasts aren't feeling full or you feel no change in your breasts after you latch baby, a lot of people get a letdown effect. Not everybody gets it, but like it's almost like a tingling effect in your breast when baby is on. If you're not feeling that tingling effect, like I said, your breasts aren't feeling full, or you're doing some hand expression and you aren't seeing any milk come out, then that may be a sign that something deeper is going on. Okay. But if you're like hand expressing and you see the milk or you feel your boobs, it's probably like, okay, let me see if it's a latch. That's regular breastfeeding struggle. But if you're doing it and you're not feeling those changes in your body, then it may be, okay, I may need to get something else looked at, checked, to make sure I'm even producing the milk. Yeah. Because a lot of moms, and again, everybody thinks, oh, breastfeeding is natural, it'll come, you'll have milk. Some things are deeper, like in our body, that like metabolic, genes, and it comes from different things that some women can produce copious amounts of milk and some can't. So it's also making sure that you know your history. Did your parents have issues with breastfeeding? Did anybody else like in your family have issues with breastfeeding? When you were pregnant, did you feel your breast changing? Did your nipples get tender? Because a lot of that can help you to know how you'll act in the postpartum period. Okay. So if you aren't feeling those breast changes while you're pregnant, if your breasts aren't getting bigger, because when we're born, we're all born with breast tissue, but it's almost like how it develops, and also, like I said, different things that you have. Like, so if you have PCOS, doesn't mean you can't breastfeed, but you may have to do some other things to help you breastfeed. So all of that plays a factor into breastfeeding. So it just, and I hate to keep saying, see somebody, or do your research, but also talk to your provider. So that's one thing, like when you're picking a provider, whether it's an OB or a PD, make sure you're letting them know, like, hey, I want to breastfeed. This is my goal. Like, this is my goal. This is what I want to do. Do you see anything hindering me from doing that? Yeah. Because they know your labs. They know your history. So if they do, then like, well, you have XYZ. I recommend seeing somebody, or I recommend doing this once you have baby. So it's just kind of like knowing your body, knowing your history, but also watching your baby and staying in tune with your body to know exactly what's changing.
That was deep. That was a lot, but it was needed.
Because it's so much that goes into it. Like I said, people just think breastfeeding is natural, normal. Yeah. I got it. And then you see all of these women on TikTok and they're pumping 50 ounces a day. And I'm like, y'all, that's not normal.
No, it's not.
It's not. But everybody gets that in their mind, because I'm not gonna lie. With my second child, I'm feeding, pumping, and he was my preemie, 36 weeks, 6 pounds. Like, to this day, still looks like he's 1. Like, he is not growing. But it was so hard because I'm like, I'm pumping, I'm not making enough. And so when I finally found a lactation consultant that I was comfortable with and could talk to, she was like, you're pumping at what he eats. Yeah. You're fine. But I'm like, but I'm not filling up bottles like they are on Instagram. But she was like, that's not normal. Those are called overproducers. Yes. And they also have their own struggles in the background. Yeah. That they're not showing you on TikTok and Instagram.
Because now they got to let all that milk out.
Yes.
No, thank you.
Yeah. So once I started doing more research and I'm like, oh, I'm glad I wasn't an overproducer. I was like, because I don't think I would have been able to keep up. I would have like, take it. I'm done.
I'm an overproducer. And I had to, so I was the opposite. I was working backwards to like lessen how much I was. Yeah. Which is one good thing of like being exclusively breastfeeding him now, because, okay, so when I had my struggle, and this was my next question, which is perfect. But when I had my struggle, then I just went straight to pumping, because then he wasn't latching. I was getting frustrated. My nerves is bad. So I was trying to remember when the last time he would latch. And so I was like pumping every 2 hours because my boobs were filling up. So I had all those cues, right? Yep. But then of course when I say every 2 hours, y'all, I wasn't leaving my house, because every 2 hours your girl was on a pump. I was a non-dairy milk farm over here. Yeah. And to this, like right now, if you open up my freezer, nothing's fitting in there because that's how much milk is in there. My deep freezer is half full. So there's literally like milk, and then like you see my chicken and my sausage patties. And then my freezer in my house, like when I say there's no space for, like, I couldn't even buy a small bag of corn. It's not going in there. Yeah. Nothing's going. It literally looks like the only person that eats anything frozen is Deuce. And that's just the way I live, right? Well, at that moment. Yeah. But then once I started to get help, and then I was getting him to latch correctly, I feel like my boobs started slowing down. Mm-hmm. So there was one time where he started to sleep all night, and I wasn't used to that. Well, we know that when they start doing that transition, which is great, because I want you to sleep all night, but my boobs not used to you sleeping all night. I had woke up and I was like, oh, they hurt so bad, so I pumped, and when I tell you, it looked like 2 ounces came out of that. Now, mind y'all, when I say I was filling up these pumps, I mean filling up the pumps were like I was pumping at least. This is in one sitting with both boobs. I could probably fill up a 10 to 11 ounces. Yep. And that's within like 15 to 20 minutes. That's a lot of milk for a baby who barely eats 4 ounces. So once I went exclusively breastfeeding him, I feel like my boobs adjusted. And then like slowly we was coming back down. Yes. But in the beginning, I was like that. I'm like, I need to have all this milk stored. I need to be able to do this. And then baby, Bree be like, you got a bottle? No, I don't have a bottle because I'm just going to pop him on because my boobs. So now, even if we miss a feeding, I'm not extremely engorged. And I feel like I'm a lot better. So my question really is that for moms who do have the struggle in the beginning and then they go to pumping, would you say that's an okay thing, or is there, I don't want to say it's bad, because I feel like there is a thing, okay, for instance, I'm putting Desto back in the conversation. So I exclusively breastfeed. She's moving more so towards exclusively pumping due to how horrible it was. But she has all the cues, like her boobs are huge, or like she feels like it's here, right? And she's just like, this stuff won't come out. So I got her a manual pump, and it was working a little bit better than the Mom Cozy, which is what I think that she has. I don't know if I want to say advice, but I guess would it be any advice to moms who are just like, this latching thing isn't for me? Yes.
So exclusive pumping is another option. But again, I want to say be careful with that, because then you become that overproducer that now has to pump every 2 hours. So usually with even the moms that are separated from their babies, like at birth, we do say those first 72 hours are crucial. Because that's when you're teaching your body how to release the milk. This is how much I need you to produce. Okay. So my rule of thumb is 8 to 12 times in 24 hours. So that's kind of like every 3 hours. But you want to pump, like those first three, especially that first 24 hours, you may not see a lot in the pump. Yeah. But I say keep going because your breasts need that stimulation. Okay. Now, once you do start pumping and you start seeing, if you notice that once you're pumping, you're getting those 10 to 12 ounces in a feed, at that point, I would tell a mom, stop pumping to empty and just pump to release. Okay. Because the more you pump to empty, the more you're telling your body, hey, I need you to make more milk. Yeah. Your body's going to keep making the milk. So then when you did produce on, and his saliva started telling your body, I don't need all of this. Yeah. Because I'm shocked when you first start putting them on, he didn't start choking. Yeah. Because usually, like, your letdown is so powerful once you become an overproducer, your baby's like, what is this? Why is it so much?
He greedy.
Stop. He probably was like, nope, this is what I need. But right. But no, your body starts getting used to, okay, this is all I need to make. So that's why you started kind of like slowly, your body slowly started withdrawing how much milk it was making. But for those moms that want to be exclusive pumpers, like I said, every 3 hours is good. But also, you have to remember, not everybody's body is the same, and not everybody's body will react to the pump the same. Me in pumping, I had to use a certain pump, certain flange size. That's another thing. They always give us like 21s and 24s in the kit. A lot of people's nipples are like a 17, 19. Okay. So you do have to make sure that you are sizing your nipple, because if you have too big of a flange, you won't respond to the pump. A lot of moms that are exclusive pumpers, I also tell them, make sure you're getting a hospital grade pump that has not the handheld, like we love a handheld because then you can move around, do what you need to do.
Yeah.
A lot of people don't respond to the handhelds. I didn't respond to the handhelds. That's why I was like, you can have it.
Yeah.
Because
they're my friend.
I couldn't respond to a handheld. I had to sit there with the can't even remember what it's called.
Medela?
No, it wasn't the Medela.
Not the Spectra.
Spectra.
Yeah.
I had to sit there with the Spectra, and that's how I had to pump because I couldn't respond to the ones that went inside of my breast.
Yeah.
But everybody responds differently. So I would say that is also an option, but be careful as far as if you notice that you're making too much and it's not something that you want to stay consistent with.
Yeah.
Because if you don't stay consistent, then you become to the engorgement. Engorgement turns to mastitis. Mastitis is now an infection. Now you back in the hospital.
Listen, I done experienced all of this.
Yeah. So you may not done that.
Yeah.
But I'm just saying, but you do want to make sure that you are paying attention to your body. So if you notice, because a lot of moms don't pump and I'm not getting anything. Again, flange size. Making sure that you have the right suction because you could be suctioning too hard and now your breasts aren't responding.
Okay.
Could not have enough suction. It's a lot of things that go into the pumping too, but that is an option.
Okay.
And I do encourage moms to do that. Like if you can't get baby to latch, but you do want to breastfeed, do pump. But like you said, you got the manual pump. The manual pump, a lot of moms respond better to a manual pump than they do to an electric pump. But of course, who got time to sit there and manually pump for 15 and 15 just to get that milk?
Your forearms is going to be strong.
Yeah. It's going to be walking around. It's going to be good. So that is something that I would recommend if you can't latch.
Okay. I'm going to get to my last question. It's not a bad one. Okay. It's an easy one. But what's something you wish more partners, family members, or friends understood in supporting a breastfed mom? Or a mom who's breastfeeding?
That's a lot of layers.
Right?
In the first couple days, expectation-wise, the first 24 hours, your baby is going to have a great feed and then be super sleepy. A lot of people that aren't used to that will be like, you need to feed your baby. Something's wrong with your baby. What is happening? And then they'll be like, no, you need to give baby a bottle because you can't wake baby up. Yeah. Baby being sleepy after a good feed is totally normal. Okay? So those first 24 hours, like I said, if you get that good feed and baby is sleepy, skin to skin is your best bet. Baby will eventually wake. Day 2, baby is going to catch up. Yeah. Because you're like, why is my baby crying so much? That is what's called cluster feeding. Okay. A lot of family members will tell you, oh, your baby's hungry. You're not making enough. You need to give formula. I need our family and caregivers to know that this is all normal. Yeah. So as you, the mom, are doing research in your prenatal period, I would encourage you, send that article to your spouse or significant other. Send it to your mom if she's going to be in the delivery room with you. Yeah. That way y'all are all on the same page and they're not trying to tell you, well, this happened to me, you need to do this. That's another thing. You can talk to your friends about their experiences with breastfeeding, their experiences with birth. Your friend may tell you, I had the perfect vag delivery. Everything went great. I didn't need an epidural. And you get in there, you're like, I can't take this. What is this? But then they end up cutting you. Like, everybody's everything is different. So you can listen to everybody's experience, but don't take their experience as what you are going to experience once you get in there. Yeah. Like, take your experience as yours. Do what you know, kind of like what you've learned. If you have questions, ask. But also for caregivers and parents, support. Support that person that is breastfeeding, because breastfeeding is mentally taxing. Pumping is mentally taxing. So having to keep up with your body, I got to eat 3 times a day. I got to drink my water. I still need to go take a bath and do what I need to do. But I also have to watch my baby to make sure that I catch him or her before they start yelling at me to latch them onto the breast. I have to make sure that they're peeing and pooping. I need to make sure that they get a bath. Like, it's so much that mom is having to try to juggle. And then if it's other kids in the mix, I got to feed them too, get them ready. So just being as support. Yeah. So I know with my middle child, like I said, I breastfed and I also pumped. My husband, he was the dedicated pump washer. When I tell you he had pump washing on lock, he had his own station. He had what he was going to do as far as washing the pumps. Like, I never had to worry about if a pump part was going to be clean. Yeah. Like, all I had to do in the middle of the night is roll over, get my pump part, put them on. He had that on lock. So just ask your partner, what do you need from me? Whether it's washing the pumps, washing the bottles, making sure the cover is clean for when y'all go out in public, anything like that. If a breastfeeding mom, like getting her comfortable in the chair, she may need an extra pillow and she don't want to have to get up to go get it. But just like, I even had like a little rolling 3-tier thing. He would make sure that was stocked. So I got my snacks in there. I got my drink if I need drinks. I got diapers, like everything I would need if I'm sitting there breastfeeding him. That way I don't have to get up. Everything is right there. I can just grab it from the cart. So just knowing what your partner needs and also supporting and being patient. Don't come with your 2 cents of advice of, he been on the boob too long, you need to take him off. Or you holding him too long, you gonna spoil him. Or, like, we don't need your 2 cents of advice when we trying to breastfeed our child. Yeah. We don't. So support, patience, and then just learn with them. Because that breastfeeding mom just needs that support. Yeah. Like I said, it's mentally taxing. Yes. It's a lot.
It is a lot.
And then, they expect us to do it for 2 years. So
right. I think this was a really great conversation. And the reason I really want to have it is because you were saying, I think more people are breastfeeding now. But like my mom, she didn't breastfeed. And not a knock to her. Not a knock to anybody who also does not breastfeed. I was like, if you like, girl, I don't have the time, the patience, I gotta work, whatever the case, whatever your reasons are for why you decide not to breastfeed. This episode isn't to make you feel like you have to breastfeed. No. If you gotta listen, as long as the baby is fed and healthy, the baby is fed and healthy. Bottom line. But as someone who decided to breastfeed and having, and now my sister is breastfeeding, knowing that my mom did not, there was no one for us to talk to. Yeah. So, and then when you're in a hospital, you're assuming you're going to get all the help you need. I'm just going to take what you say as the golden rule, and I'm gonna rock with that. And then you leave that hospital and you go home and you remember 2 things that person done said out of the one time that they done came to your room, and then you at the house frustrated, nipples hurt, overwhelmed, and baby crying, and now you crying. And I say that from experience. Yeah. Like Breland was probably my worst breastfed experience, and I just remember her laying on the bed and she started to cry and my nipples hurt. When I say they hurt so bad, like when she would latch, this pain is undescribable. And it's just like, what are we doing? And your whole body is tense. Yep. And she started crying, and then I finally broke down and I was bawling because I knew I had no milk stored up. She's crying because she's hungry. I'm the only one that can feed. Is how I'm feeling. I'm the only one that can feed her. If she don't eat, she gonna die. I done carried her. I done birthed her, and now I can't do this, right? And then at the time, Brielle was 5. She walks in the room in the middle of me, having my meltdown. And I was like, I just done scarred my child. I scarred one hungry. Now you spiraling. Right now I'm spiraling for real. And all I know is I immediately call Bree. And I think that's something a lot of moms don't do. And I've said it a lot of times, that we tend to take on everything, not realizing, hey, just tell your spouse or whoever is there to support you, like, this is what I need. And so I like that you mentioned the cart, because I do feel like as moms, we take on everything because we carried the kid. We gave birth to the kid. Now you're breastfeeding, so you feel like you're the sole provider. It took 2 of y'all to make that baby. Okay? Get him up. He can get up. He can do something. And ask for the help. And the crazy thing is I don't know why. It's not like I didn't think Bree wouldn't help. But it's just, I don't know.
It's just in our minds, we feel like we got to do it. We done made it this far. We done all of this. We got this. We can do this. And then it's like, no, I can't.
No, boss. I'm clocking out. And I ain't coming back no 2 weeks notice. And so as soon as I was like, you got to take the baby and take Brielle. And I just went in the shower. I regrouped. And then we called it lactation. And I also like that you said, if you got with someone that you felt comfortable with. When I tell you the lactation lady I had in Texas, A1, she the best lady I've never seen in my life. The tips and trips, all the things, So find somebody that you can trust. Find somebody that's giving tips that actually work for you. And I like that you also mentioned that all positions and things don't work for every baby. I've had 3, she's had 3. And so we're literally telling y'all, do not get frustrated with yourself if you're on like your 2nd or 3rd or 4th kid. What happened? You want to have your business, be fruitful and multiply. Have fun with it. But if it's not the same, then it's okay. So I appreciate you for coming on, because you dropped a lot of things that I still didn't know. And I was like, okay, well, that's good. And even though breastfeeding has become a lot easier for me at this point, there's still days where I'm like,
what am I doing?
Well, yeah, why? Now I just want to give you table food, because I don't want you on me. Yeah. I want to be free when I ain't got to wear this nursing bra no more. Because if you wear them everywhere.
When I was able to buy regular bras.
You know how many times I done went outside and worked out and then went for a jump and then was like, wrong bra.
Like pop out.
Right. I was like, I can't record that one, because that I want to pop the boob out on camera. Yes, I'm enjoying the moments, but I'm also excited to see him experience food and we not have to be connected 24/7. So my last question to end off this episode is, what has motherhood taught you?
Motherhood has taught me to be flexible.
No.
To expect the unexpected. I am a very, gotta do this on a schedule kind of thing.
Yeah.
With 3 kids, my oldest and middle 8 years apart, there is never a day that is the same. So my expectations have just gone out the window.
Yeah.
And I just kind of take it day by day, sometimes hour by hour, minute by minute, but also knowing that that is okay.
Yeah.
We get the vital stuff done, but just going with the flow. Not trying to be so stringent that I have to, if one thing is not done, that it just messes up everything.
Yeah.
But that's something that I've had to kind of very much work through, because not having a schedule makes me anxious. So that's something that I've had to work through on my own.
Yeah, I know. I love a good schedule.
Yeah.
Look at all of it.
That's what motherhood has taught me.
Yeah, that's a good one. We've been saying patience a lot, but flexibility is one. And I think I mentioned that on another one. And especially when you have kids in different age groups. Because I literally, and I've said this before, I go from talking stern to one to let me tone it down with one to you don't say that, right? Yeah. Like, just chill for a second. I'm about to change your diaper. So that was good. Well, thank you for coming on.
Of course, thank you for having me.
Yeah, I'm going to have you on just for some regular little chit chat.
Yeah,
we're going to dive into some other stuff. Y'all know I love my guests, especially people from where I'm from, because I feel like a lot of people, if you're from Lamarck, it's a small town. When you grow up in a small town, you know everybody, you know where everything at. You can say one thing and everybody be like,
know exactly what you're talking about.
Cousin, and I be like, first off, I wasn't talking about her. And so I think we have a lot of well-educated, because y'all know our situation out here. If you know, you know, okay? Yeah. But I think we have some well-educated women and men in Lamarck, and I'm happy to get them on the podcast and then just kind of have regular conversations, have conversations like these with people I either grew up with or just people in the community, because there's a lot to be out here in Lamarck. I know a lot of people are like, Lamarck is going now. Football team, we still them ones. Don't play with us. But don't, regardless of what ISD we in. That's a little crazy.
Still a sore subject.
It's very touchy. We all getting used to it. For those who did not grow up in, the ones that we had our own, we may have to come back and just have a Lamarck one-on-one conversation. But no, I really appreciate you for coming on and dropping the gems. Yeah. So hopefully these 45 minutes to yourself was great.
It was.
Yeah.
And I'm going to drive real slow.
Yeah, I'm about to say drive real slow. Stop by Starbucks and get you a coffee.
That's the thing. My oldest already said, hey, you going to go to 7 Brew and get me something? Am I cool? No.
I'm going to pass by. I may go, but then I'm going to sit in the parking lot and drink the coffee, then I'm going to come home.
You ain't going to never know.
Right? Well, this is the end of our mom series, so we're going to go right back into season 6 with Desto and everybody else who decided to, not decided, but who graciously came on to be a guest for those episodes. So thank y'all for tuning in to the mom series. Make sure you like, share, subscribe, all the things. I got to get better at this, promotion thing, because I be like, Destiny is really good at this. I just be like, Tell me what y'all like in the comments, you know?
Yeah.
Yeah, just holler at your girl. But until next time, see ya.